morning, everyone. I am Dr. Nalini Kaushik and welcome you all to yet another session as we observe the second day of Cancer Summit 2022 at the Integrated Health and Wellbeing Council. Cancer is a challenging disease for all health systems and for all the individuals placed in that particular ecosystem. Affected by this deadly and a crippling disease that makes patients vulnerable due to various factors, they also encounter problems in accessing cancer services due to not only the economic barriers, but also due to the related social determinants of health, which could involve stigma, discrimination, certain social assumptions, geography, and many a times even gender. And this adds a toll not only to the physical health, but also the social and the psychological well-being of patients and their families. In our today's discussion titled Cancer Care, Everything Matters, powered by AstraZeneca, we are here in discussion with our diverse panelists to understand these dimensions of cancer and how patients can be supported better. We have with us today Dr. Khurshid Mistry, who is a trustee of NK Dhabhar Cancer Foundation, Ms. Isha Khosla, clinical nutritionist, columnist and author, Ms. Hiba Siddiqui, who is a senior psycho-oncologist, Max Institute of Cancer Care, Max Healthcare, Ms. Vandana Gupta, who is a founder, We Care Foundation, Ms. Matrushri Shetty, Director Programs and Strategy, Lung Care Foundation, Ms. Neha Anand, Senior Assistant Director, FICCI Breast Cancer Survivor. Also, we have with us Ms. Rebecca D'Souza, who is the Director of Survivorship and Community Research, NARC Foundation. Thank you so much to all of you for sparing your valuable time and being here with us today. And I would be starting and putting the entire conversation into context by bringing in Dr. Khurshid, to begin with. Thank you so much, ma'am, for joining us and, sparing your time for this on this particular and very important day, for cancer. So if we just, since our entire conversation today is centered around, patients and not just the treatment aspect, because more often than not, we end up talking about only the access of treatment and, diagnosis, but what really happens and what's the journey that, a patient goes through. And I'm sure in your experience, you closely, you've been observing and almost living that reality, with so many of your patients day in and day out. So, just to put a context to it, what are the common stresses and complaints and, aspects, that are usually, you end up discussing, with your patients when they're diagnosed, with this particular, any particular kind of cancer. Over to you.
So thank you. Firstly, I'd like to thank the organizers for bringing up this very, very pertinent topic in cancer treatment. I mean, nobody really now, luckily, people have started talking about the different aspects of the cancer treatment, apart from the surgery and the radiation and the chemotherapy. And so absolutely right. So from the time of diagnosis, from the time the patient and the family, of course, learns of the diagnosis, it's like something has hit them. It's like a tsunami hitting them. Right. And well, as an oncologist and as a busy oncologist, mostly we give a very clinical diagnosis and say, this is it. These are the treatment options and this is what you will be following. But what the patient actually goes through is a completely different scenario.
Right.
The moment they walk out of the clinic of the oncologist, it's like it's like, as I said, their entire life is put out of array. It's derailed.
Right. Absolutely.
So from sleeplessness to lack of appetite, and this I'm talking of not just the patient, but the entire family. These are symptoms which just the patient does not go through, but the entire family goes through. The entire vulnerability, the uncertainty in life, like what is going to happen tomorrow. So they go through sleepless nights, they go through lack of appetite, irritability, anger. Anger is a very commonly seen thing, and for the family to cope with that again becomes extremely difficult because it's like, there's a change of personality in the person. A normally calm person suddenly becomes very irritable, very angry. Obviously the physical symptoms are there, for the patient, but it's a whole package. It's not just the physical part, but a whole gamut of experiences which they have to go through.
Absolutely. Thank you so much for bringing, that aspect, because it's easier said than done. But, like you said, there are physical symptoms, but what really goes inside, when we talk about the holistic health and the well-being, the emotional, social, psychological, all that well-being, that really, this entire kind of the disease is such that it's puts a question mark to all of those aspects. And I think, we have with us, with us Miss Neha Anand. Thank you so much, Miss Anand, for joining us today. Thank you for your, sparing your time. So we just heard Dr. Khurshid, from her expertise and, from her experience, of interacting and living that sort of a reality with patients. But with you, you've lived that reality all by yourself. We can just keep on talking about it, as from an outsider's perspective, but you've lived all the intrinsic nuances of going through that entire journey of cancer. So what was it, that what was your journey, and from all the different aspects that we are putting in question today. Over to you.
Thank you so much for giving me this platform to share my journey. Of course, cancer takes a lot of toll on you, be it the physical, be it mental, be it emotional, be it psychological toll.
Right.
The first question that came to my mind was, why me? I am just a 32-year-old woman, and I just got my first child. What did I do wrong? Where did I go wrong? Why me? So, I think acceptance is the first and foremost, the most important part was the most important part in my cancer journey.
Yeah.
Once it took me some time to come to terms with the fact that yes, I have cancer. So, I think apart from all the support, my family support, the doctor's support, the friends were there for me, the office colleagues, but then I think the most important part is how you come to terms with the fact that yes, you are a cancer patient, and how soon and how much willing you are able to accept it, and then decide that you would want to move for better ahead in future.
Thank you so much for sharing that. And I think it's really, it's like, we were saying that it's an individual journey, and from outside, we can just keep on talking about it. But like you said, and everything I think you just said right now are the nuances which interplays, at an emotional and a psychological level. And like you started, that why me? I think that's a very normal human reaction, but how it really affects your day-to-day life, I think it's very difficult. So bringing in Ms. Hiba, like, since we are right now talking largely about the psychological and the emotional well-being, you interact with these patients and counsel such patients. So from your perspective, what are the most common psychological and emotional symptoms that you see in the patients, and what is the services that you provide, and what kind of how is it addressed for the patients?
Yeah, thanks, Nalini and team IHW for having me with such amazing women alongside. That's a personal pleasure. But I think just going by the conversation that's already going on, and like Neha shared her experience, I think that the impact of cancer and the diagnosis or the illness in general is a very subjective experience, right? For both the individual as well as the family. Absolutely. Now, the impact, of course, is both at an internal level, which are your emotional, cognitive changes, physical, like Dr. Mistry talked about, and so on, but it's also external. How am I with the society? How am I behaviorally? And at the end of the day, when the whole range goes from the psychological, behavioral, social, the symptoms can be of any intensity. Neha talked about how acceptance helped her, but sometimes people come in with a lot of shock value. For them, there's a lot of guilt. There's a lot of regret. Where did I go wrong? There's a lot of self-blame, or even finding blame in others. So in those, if I talk specific symptoms, and again, I'm generalizing based out of my conversations with people, that a lot of times there's a sense of isolation and that aloneness in that journey, that nobody gets me, right? And a lot of times there are changes, there are conflicts internally between, relationships, between family, friends. You feel the othered.
Yeah.
So apart from the symptoms that you're feeling, no matter what age group you're part of, you're also feeling that I'm not like the others in my age range. And I'm not liking that difference because that's not welcomed by me. So I think that it's also to understand that the dysfunctionality that exists, not just with the mere understanding that I have cancer or the word, but actually how much of day-to-day disruptions that it may or may not cause for you.
Right. Absolutely. Thank you so much for your inputs, Miss Hiba. And we will move on to Miss Ishi now, because thank you so much, Miss Ishi, for joining us, first of all. And we are talking about, the emotional and the psychological well-being here, but also understanding that, it's an immunocompromised condition, cancer. And nutrition also plays a very critical role, and not only just for the physical body. Again, it has a very close connection with your psychological and emotional health. However, the journey or the experience that a patient might go through, they might even compromise on the nutrition, right? So what are the critical aspects of holistic nutrition when it comes to cancer? Over to you.
Thank you, IHW and the organizers for having me here. And before I answer your question, Dr. Nalini, I personally would just like to add on to the narrative which has just been shared about the diagnosis and how a person feels. And in my meetings with patients with similar survivors at meetings, etc., the one thing that really strikes everybody is, like she said, Neha just said, where did I go wrong?
Yeah.
And what is the where is first thing is food. What did I eat wrong? Where did I use a wrong oil? Did I have too much of junk? Did I not, pay enough attention to my food? Or did I have nutritional deficiencies, etc., etc., etc. So this whole thing starts in the mind of a diagnosed person right from there, and it's very difficult to put a finger on it, in terms of what happened, because you did whatever you were, you have been used to doing, and whatever has been your practices, and maybe not different from XYZ, but what happened to you, right? So food certainly becomes the first line of attention. But having said that, in my meetings with such people, if I ask them one simple reason which they could ascribe to developing their condition, all of them, and this is in all meetings, you will be surprised. All hands go up when it comes to stress.
Yeah.
Everybody confirms that, yes, the year before that was very stressful. Right. The time before that was very stressful. Or I've had chronic stress. That is something which nobody denies. And there's something to be said about it. You cannot ignore that. And it's difficult to measure it. It's difficult to, say on a scale of 10, what is your stress level and how is it different from the other person's. But certainly there is some merit in probing in. So before we go on to what is right, what is wrong in food, we need to understand that, stress comes also as a function of dysregulation of our internal ecosystem. Right. Apart from the external. We do have stressors all around. They haven't been less in the last, say, since 1940s. There have been wars, and there have been famines, and there have been so much more stress. Of course, COVID has got its own stressors. That's a recent stressor. But all in all, stressors have been there. But when there is dysregulation of our internal ecosystem, and to be very precise, we talk about the gut-brain axis, the digestive system. If there is what we call a dysbiosis or an imbalance in the gut flora, in the and somewhere we don't know exactly how this works, but certainly there is a connection with our cellular metabolism and how it is regulated and how things go abnormal. Yeah. So let's go back to the conversation on diet. And if there is a gut connection, then whatever goes into your gut is basically food.
Yeah.
And, we need to figure out the connections between, why the cancer happens, why dysregulation and mutations happen at the cellular level, and what is the connection with our gut. It's a very abstract sounding area, but it's really not so abstract, because it not only resonates with traditional wisdom, where all diseases begin in the gut, is what Hippocrates said 2,500 years ago. But this is what is now being confirmed by scientists who are doing research on diseases. So, so far it's always been genetics.
Yeah.
If it was genes, if it was only genes, we wouldn't have the rates that we are seeing today. Genes don't change.
Right.
That, they take thousands of years to change. And I was reading a data, which I must share, the UK data, that people born in the 1960s, after the 1960s, have a 1 in 2 chance of developing cancer.
Yeah.
It's huge. It's really huge. So something in our environments has changed. And I think the most profound change is our food and our diet. So rather than feeling that it is a tertiary part or just an ancillary to the treatment, I would put that as the most important cause and therefore the treatment. So, that's how you cure, when you know the cause. And today we understand a lot. I don't think we understand everything. And there was this, again, very nice data, which I was reading, that more money has been spent on cancer research and why cancer happens than NASA has spent so far. So we are, really trying to get our answers. But what really makes a good diet for a person to prevent cancer and to also, like you said, immunocompromised post-treatment, during treatment, what it is, what it should look like. And the 2 words I would use to describe the diet would be an anti-inflammatory diet.
Yeah.
And a diet which also addresses blood insulin levels, which means a carbohydrate metabolism, and sugars, and also lastly the immune system. Something which helps to build the immune system back.
Right.
So these are the 3 things. So it's the 3 I's: the insulin, immunity, and inflammation. And I think the best way to look at a diet would be to understand that we have basically 3 or 4 nutrients we talk about in nutrition: proteins, fats, carbohydrates, and fiber. And of course, we have phytochemicals, etc. So, I mean, it's really a no-brainer that whenever you say a healthy diet or an anti-inflammatory diet is all about vegetables and fruits. And, that is the picture that comes to you.
Yeah.
But where do we go in terms of how does this happen? And not that Indians are not having enough vegetables and fruits. So why does it still work against us? So the thing is, let's look at, I was just thinking, I'll call it CRPF, cereals and the rainbow diet. And cereals means what kind of carbohydrates you have. The choice of carbohydrates, the cereals, and the quantity and when you have cereals is critical. So to be very precise, we need to have anti-inflammatory grains. Yeah. We know that wheat is pro-inflammatory. We know that certain other grains like corn and soya can be pro-inflammatory. So look at anti-inflammatory grains. Look at the number of servings of cereals that you have in a day. You may not need the amount that you're taking. And also avoid cereals post-sunset. Yeah. Yeah. These are very critical pieces. So that's very central. And cereals, apart from that, sugars.
Right.
They are also cereals are one step away from sugar. Just in a few minutes, they become sugar. And we know the correlation between sugar and cancer today.
Right.
So, sorry, Neha, Nalini, the answer is going to be a little long, but
that's a much needed one. So that's absolutely fine, ma'am.
Yes. Sugars in direct form need to be cut down clearly because cancer cells feed on sugar. I cannot say that cancer is caused by sugar, but certainly when you have it, it needs to be arrested because it can cause dysbiosis of the gut and imbalanced gut flora, etc. So, but sweetness can be there in the form of natural sugars like honey. We shouldn't club it all together. Honey is different from sugar.
Yeah.
So honey, jaggery, and dry fruits and some fresh fruits are good ways of satisfying the sweet tooth.
Yeah.
So then we come to the importance of proteins, protein-centric diets. So far, our traditional diets are all grain-centric. We first put our mound of rice or our chapatis, and then everything is on the side.
Yeah.
So let's now look at having protein as an important part, because we do need adequate protein. I'm not saying excess protein, and I'm not talking of protein powders and supplements. I'm talking of plant protein or animal, good quality animal protein. So the quality of protein, so the quality of carbohydrate, the quality of sugars, the quality of protein is important. And excessive processed meats and processed and red meats, etc., need to be cut out. And that's a no-brainer. And so you focus on at least 2 meals with proteins. And then we talk about good fats. And good fats, again, fats have been in the line of fire for unfortunate reasons, but they actually are very, very supportive of our immune system and our gut health. But again, good fats. I'm not talking of trans fats, which are in hydrogenated fats or in margarines or bakery, which is commercially prepared, biscuits, etc. I'm talking, or even for that matter, reused oils. I'm talking of healthy cold pressed oils. I'm talking about butter. I'm talking about ghee. I'm talking about virgin coconut oil, olive oil, and all those things which are totally central to the traditional diets. And they need to come back, and they provide a lot of support to the treatment and to recovery. So good quality fats also come from nuts and seeds. Just simple, again, they were part of our traditional pinnis and the panjiris and all of that, which, winter was also all about. But somewhere there was a fear of fat, and we abandoned all that. And fatty fish, certain kinds of anti-inflammatory fats, which include omega-3 fats. The fats in fish are those fats which help in controlling inflammation. And in the plant kingdom, we have them in the form of flax seeds, chia seeds, green leafy vegetables, mustard seeds, etc. So, just focus on those kind of healthy fats. Lastly, what I call the rainbow diet. The rainbow diet is all about 7 colors and having the rainbow colors on your plate. And this is so critical because these colors have what we call the phytonutrients. Phyt literally is FIGHT, but this is spelled with PHY, but it does the same thing. They really fight for our protection and prevention of the diseases. And how do they do that? They are the ones which are the phytonutrients actually decide which genes are going to be expressed and which are going to be silenced. They are so potent. So ensure that your plate looks like a rainbow, or at least your day looks like a rainbow. And having all those 7 colors of the rainbow on a daily basis can be one great insurance to protection, and whether it's prevention or treatment of cancer. So with that, focus on gut health, because I spoke about gut and brain axis, taking prebiotics, which are fiber-rich foods for the gut flora, and probiotics when you are on treatment to support your gut flora, are all critical. And of course, fluids and eating less and eating early and eating seasonal, local, all of that becomes a part of all this. So I think that is fairly, comprehensive and easy to do. It's just a little bit of thinking and revisiting certain things that have been said in the past.
Absolutely. And thank you so much, first of all, for that really comprehensive answer, because in the kind of times we live, in the kind of circumstances we are, diet becomes really important. And I think I do have certain follow-up questions that I would be coming back to you, circling back to you in some moment. But also, I think one thing that you also mentioned was, stress, which is, one of the most invisible factor, because it is not only about what we are consuming, maybe actively, also passively. And stress is something which we are passively consuming. It is for lack of better, explanation, I think it is something that we are consuming as a diet. In fact, a passive diet for that matter. And I think it's really critical. And I'm sure, the audience that is watching us today, understands, these factors, in a much better light after this session. And circling the conversation towards, now the patient advocacy groups, because cancer, the nature of the disease and the various factors which are really important for a person to be aware of, like we just spoke to our different stakeholders here. The right knowledge, it becomes really important when either you're prone to certain kinds of cancer or when you're detected. So I would go to Miss Rebecca and Miss Shetty for the next round of questions. That the nature of that disease is such that you do require external support, you do require more like hand holding when you are really going through that journey. Our patients in our country specifically are really aware of the patient support groups? Are these support groups easy to access? And how does that entire, unfolding happens for patients? So we'll just start with Ms. Rebecca with you on this.
Thank you for this opportunity. And unfortunately, most of the support groups that are within, example, my city that I am, are attached to medical doctors. Yeah. So they're mostly support groups which are advocated by medical oncologists. So you have a support group with only patients that are taking treatment under that particular doctor. So maybe there might be about 2 or 3 support groups in my city. I'm from Pune, and there's not much of knowledge amongst patients about the existence of support groups. They don't understand how it can make a difference. So the best way for us to reach out is when we have survivors or patients themselves who advocate support groups.
Right.
So for example, we have trained survivors.
I think we lost Miss Rebecca. Miss Shetty, let us start with you and then we'll go back to Miss Rebecca again.
Yeah. Thank you, Dr. Nalini. See, there are a couple of points before I come back to support group that I just wanted to highlight, adding on to what Dr. Khosla had mentioned. She talked about the inner, the gut related, the inner ecosystem that gets damaged. And sometimes you start questioning on that. I think in today's world, when we talk about stress and we talk about other factors, the biggest factor that we are also, that is today impacting us and is somewhere and is majorly linked to cancer is the environmental factor.
Yeah.
So the very artificial, unsustainable living that we are all going through, and the kind of exposure levels that we have of various pollution components, whether it is air pollution, whether it is water pollution, whether it is so many other kinds of things that we are facing. So I think that becomes very imperative to be talked about, and something that that people need to understand and move towards living a more sustainable life wherever and however possible. And this goes especially for the larger cities. And I mean, the aspiration levels of moving to what is so-called, what we call developed, that concept needs to change.
Right.
I think that is where the sole issue, when you talk about the health impacts across various various specialties, whether it is you talk about various forms of cancer. So I think the root lies in bringing about a change there. So whether it is your external environment or internal environment in the form of our food. So talking about that, having said that, at Lung Care Foundation, we have a sister organization called the Institute of Chest Surgery, headed by Dr. Arvind Kumar, who is a lung cancer specialist, and the team looks at forms of cancer in terms of lung cancer and esophageal cancer and other forms. So one of the biggest challenges that has happened, while the patient comes to for a cancer treatment or has been given a diagnosis of cancer, the first thing that once it sinks in, it forms of the anxiety that comes out is it's like a death sentence.
Yeah.
Now nothing can happen for me, and have to start looking at what needs to be done in order to complete my responsibilities and things like that. But that anxiety, it actually eats away the patient, at least initially, immediately after the diagnosis. And at that point, you have also multitude of, we being an Indian society, and I'm building this context, we are a very close-knit society in terms of our relations. But sometimes many relatives can be helpful, but there are many people who would also start putting in doubts, more and more doubts. The kind of questions and the conversations that you have with, when you don't have enough information, when you don't have enough knowledge. So instead of, in the effort of trying to be supportive, they in fact hamper more.
Right.
So that often happens, and they start giving conflicting views on what the cancer treatment should be, how it should go about. And this is what all informal support groups we are talking about, and this is not the technical ideal support group systems that needs to be there. So when you talk about ideally a support group has a tremendous scope and work that it can do, and the kind of care that it can offer to a patient going through the process, surviving through the process, whether it is physical, emotional, and also the treatment aspects and support in their understanding going through the entire process. But that technical group needs to be really sound in terms of the kind of information that needs to go about. And as I think Rebecca ji, she correctly mentioned, that a lot of these support groups are very localized and working under a cancer care specialist. But there are not many common support groups, and many of these support groups are also limited to larger cities.
Correct.
And larger cities, people in larger cities also have an option of reaching out to support groups via online medium, which is not a possibility for a middle income or a low income group, even in cities or in towns, definitely in tier 2 cities. So I think that is something that really needs to be worked on. And I think as she mentioned, that cancer survivors who have gone through the process and who have successfully come out victorious in handling cancer need to be really brought into the picture and should be motivated to take up these challenging of setting up patient support groups. And I think now almost every household today is suffering from some form of cancer or the other, and the patient and the larger family members. So that is something that we need to really start looking at and taking it seriously and a holistic perspective.
Absolutely. Thank you so much, Ms. Shetty. And I think just to reiterate, actually, at IHW, we have been observing, Cancer Summit since yesterday. And one key thing that has been, really emerging is, everyone talking about defragmentation, but also decentralization. These are two key components. And this is not just at the level of treatment, but on various aspects of, everything that pertains to, with respect to cancer care. And I will circle back to Ms. Rebecca, the same point to you, because you actually said something on similar lines that when it comes to patient support groups, they're really localized, and they are not, even today, they have not really penetrated to tier 2, tier 3 cities and areas the way it should have, right? So again, like you were already in middle of, making your remarks, but also adding more to what Ms. Shetty has also said about that, how do we take that support further to the people who really need it? And sometimes what happens is that digital interventions, as much as, they are really need of the hour and we are using them, there are many people who are not able to still access that. So, what is the entire situation like from your perspective? Ma'am, could you please unmute yourself? Yeah.
So when you look at survivorship, because survivorship starts from the day that you're diagnosed, it involves all these aspects. So there is no access to a nutritionist, there is no access to occupational therapist, there is no access to a rehabilitational therapist, there's no access to counselors. So starting a support group can actually encompass everything. The problem starts because it seems to serve the purpose of a particular strata of society. So even if you call for a survivor, a support group meeting, you will find a particular class of people will come in, and the people who actually require it either feel very hesitant to be vocal about what their experience is, or they just don't know that it exists. So coming to what you're saying is, we need to, I think it's good to start local.
Yeah.
Because unfortunately, every city has its own culture.
Yeah.
And, it becomes difficult on a bigger level because you don't understand the experiences. Like, for example, some of you all have said that anxiety about the future is something that patients see. But I've also seen the opposite side of it. People who are coming from the rural background, for example,
right,
they're not so worried about the disease and what are the side effects and what I should eat. They're just worried about how do I pass through day. So they just take today and live to it. So there is a difference in everything. So I think you start as a, and then you branch off. Another aspect, I don't know whether you all have noticed, is that everything is centered around breast cancer.
Right.
So you have a support group for women. What about the rest? We have got head and neck survivors who need it more because there's so many psychological impacts that they are facing.
Yeah.
But because breast cancer is more about, it's more vocal, more research has gone into it also. It becomes our focus.
Yeah.
So there are support groups that are online, but again, it's limited to the reach of people.
Correct.
Correct. In that sense, yeah.
Absolutely. And I think I'll just, loop in Miss Neha, here, because we have talked about role of nutrition. We have talked about role of support groups. Miss Neha, I think you've lived through all of that. And, what was your experience, because it's important to, like now also contextualize from the first-hand experience because we have you here today. So how did you overcome first, from the nutrition perspective, because we had, we also heard, expert remarks right now, but also, another, how did you access support groups? Were they like easily available, accessible, over to you.
Thank you so much. So from the nutrition perspective, first thing which I did was I got my greens straight. I inculcated a lot of loads and loads of greens in my diet, pulses, high proteins, and I made sure that I have cut down sugar, all the processed food, the junk food. I mean, all the dairy products, every single thing. I made sure that I used to eat in small parts for keeping me energized throughout the day. I never used to take complete full meals, but I used to take my meals in different parts. And I used to make sure that I get every single nutrient inside me. I started taking vegetable juices, a mix of palak, spinach, and carrot, apple, every single thing. And then loads and loads of fruits. That's it. And then I think that's it. And I focused majorly on proteins, which lacked in my diet. Yeah. And I made sure that I eat a very high protein diet.
Right. Thank you so much. And so this was one part of the conversation so far. And I think, Dr. Mistry, I think I would like to now, start with another, conversation, which is also, a very important aspect of the, of the spectrum. But more often than not, actually, it's another thing that we don't hear, which is palliative care. So if you could just again, for the wider audience today, if you can, help us understand what, first of all, is palliative care, and what is the role, it can play in improving the quality of life for the patients.
Sorry, I think I lost you for a while.
I'll just repeat.
Dr. Nalini, can you please repeat your question?
Absolutely, ma'am. So I was just saying that, there's another aspect of the entire spectrum of cancer care and treatment, which is palliative care. In India, it's a very new terminology. I think we just lost ma'am here. I think. Right. Okay. So Ms. Hiba, we'll just, circle back to you for now, and we'll, loop in Dr. Mistry in some time once she joins back. Okay. So we have talked about all of these aspects. There is another, underlying and a very, what do you say, like a passive aspect, that continues for, patients is anxiety and depression, which sometimes, may even go, unnoticed. And like we said that, stress is one thing which is a causal factor in a certain way for cancer. However, we have to eliminate that stress once a patient is diagnosed and is on treatment. However, when the patient is diagnosed, the situation is such that the levels of stress might go up, right? So that might cause anxiety and, sort of like depression in the patient. So, and which can even, interfere with the treatment. So how do you, like sort of take care of those aspects, and how, what is the care that, patients and their families can, factors that they can take care of?
Yeah, absolutely. I think when you mention, the whole concept of sometimes they may not understand, which is very rightly true, but we also need to look at that when we are faced with a very difficult situation, say, for example, being diagnosed with a chronic illness, or being told that, you have something which is always not talked about or hushed. So repression of these negative or difficult feelings or emotions should not be confused with it being hidden or not at the surface, right? Because there are barriers which all of us as people have, including all of us here today, that when we are confronted with and when we have to face with our vulnerabilities and fears rising, especially the uncertainties that I didn't plan this, I didn't expect what just happened. So a lot of times we need to see, apart from what we've already discussed in terms of the impact, that with self-reflective practices, with being able to acknowledge that I'm feeling something, I'm not feeling okay, both having communication at an internal and as well as external level. So we've talked about support groups, but it's also nice to see people talk to their friends, family, normalizing the whole talk around cancer, conversations, trying to build allies. And I think in terms of my practice, psycho-oncology or psychosocial care in Indian setups is a fairly new concept, but it's something that's really picking up because of the sheer need and existence of when people realize of the help that it provides. So many centers don't have it at the present moment, but psycho-oncology or psychosocial oncological care bridges the gap between the mental and the physical aspects of the illness. So what we can do, we can actually talk about how the families are facing during that time. We can try to educate them at a normalizing way that, there are many others that are also having, but your experience will always be of prime importance to us when you bring us. We're not patronizing you. We're not preaching the fact that look at the other person, they were better. If your experience is there, we tailor make our psychological or counseling interventions to be able to, through talk therapy, through other modalities of psychotherapy, connect to the patients and the caregivers, because the burden and fatigue in caregivers is extremely important, especially when we're dealing with long-term care, illness, and as well as grief in different contexts.
Right. All right. And absolutely. And how easy do you think it is to integrate these patients then? Depression and anxiety, it has its own pressure on the individual, again, who has another pressure of getting diagnosed with cancer. How easy it is to, get them integrated, in psychological support?
It is not very easy. I won't lie, and I'll be very honest, especially in the Indian scenario, because a lot of times they get so scared that as it is, I'm having a major physical issue, and now a psycho-oncologist is visiting me. So does that mean I have a mental issue also? And a lot of times my presence has made a lot of patients feel extremely confronted or uncomfortable. So what we decided to do was that, just like introducing the different aspects of care. So you have a dietary consult, you have a pre-anesthesia checkups, you have a pre-op counseling and so on. We added through the treating doctor, whoever was the first face to talk about the holistic care that we in our hospital offer. And so that made them aware that, someone will come and see me. Someone will come and visit. So a lot of times, some of my sessions would just be about rapport building with the patients, as well as not just the individuals diagnosed, but also their families. So there was a sense of familiarity that, say, 4 chemos down, 5 chemos down, surgery down. If I'm feeling unpleasant or some mood changes are happening, I know I can reach Hiba. So, and then we would take it from there. So I think just like I said, conversations, normalizing mental health care in cancer is very important.
Right. Thank you so much. And actually, Miss Ishi Khosla will be, she has a positive time and she would be, she has to leave for another meeting. So, ma'am, I would like to loop you in, for some remarks from your side. Miss Ishi, do we have you here with us?
Yes, you have
I know
me
you,
here.
yeah.
Yes.
So I know you have another meeting and commitment. So as a last comment from your side, if you can give us inputs on that. First of all, what would be your advice and suggestions to the larger cancer care community? Because if we are talking about holistic health and well-being of cancer patients, we have talked about the kind of diet that is important, everything. But how do we really integrate this entire concept? Whatever you were talking, because more often than not in a country like India, this is still sort of a far-fetched idea for all of us, and not only for the cancer patients, but also from the preventive side. Because that, whatever you explain, should not come at a point when we are getting diagnosed. These are diet, stress, environment, everything. These are also precursors to cancer. How do we really integrate this kind of a lifestyle? What you suggested as a normal, lifestyle, and what would be your take for the cancer community as well?
Yeah, while again, it's difficult to oversimplify nutrition, which is vast in its scope, and different aspects of food and nutrition are there. So I always find it very hard to keep it very simple. But still, I make this. There were two basic goals which I feel is are very critical. One is managing weight issues. We usually address when it's about vanity and about looking good, but it has a lot to do with inflammation, and it has a lot to do with the association with certain kinds of cancers. So managing your weight is a very important goal, not by unhealthy practices, but by a healthy and diet and a lifestyle. That's very critical. Secondly, managing waste. That means your belly measurements, because that is also highly correlated with inflammation. And towards, when we say inflammation, it is also thereby correlated with cancer. So whether it is during as a preventive strategy or even post, and a lot of women do put on weight after the treatment and find it very difficult, and it becomes almost a struggle to lose. There is need to address this as a goal, and through healthy practices.
Right.
So that's, and then addressing a diet which is customized to yourself. One person's food may be another man's poison. We also see food sensitivities at the root cause of a lot of trouble these days. So getting tested for food sensitivities, like Rebecca said, she went off dairy, because our gut becomes leaky and makes us more prone to wheat sensitivity and dairy sensitivity. So customize your diet to your needs. And lastly, I would say address nutritional deficiencies, because we have a whole area which now we're talking about the importance of the gut, that we are not absorbing our food as well as we should. So we are finding malabsorption of nutrients, and one of the critical nutrients today we find which is missing or which is deficient in our country, which is a vitamin D, which is really paradoxical because we have so much of sunshine. So vitamin D deficiency, B12, iron, and so on and so forth, calcium and magnesium. And for breast cancer, magnesium deficiency must be addressed, and difficult. So these are all I'm just making the points here for people to take back, but all of this needs to be done under supervision, and not everybody should be doing everything. So but these addressing nutritional adequacy is very important. So micronutrient, we call it hidden hunger. So people who are obese, people who are eating a lot yet are deficient, and we see that all the time, and critically deficient in vitamin B12, iron, etc., etc. So that is important also as a preventive strategy, and also prevention, and also in terms of post treatment, so that there is no relapse. So these are the few areas which I think are very, very critical, and I use the acronym of 4Gs, using gut, girth, grains, and glucose. So just easy take home for everybody: manage your gut health,
And if you have something sometimes are not associated with, a lot of patients say, oh, I have never had a gut problem. I don't have any acidity. I don't have any constipation. But very often gut related issues manifest outside the gut. So it could be a migraine, it could be a hair problem, it could be anything outside the gut. So do look at these issues, and I think these simple common sense things need to be communicated. It's not easy to make public health messages out of these, but we need to be creative and we need to communicate effectively, because I think these are simple things and need to be out there. So
thank you so much, ma'am, for joining us and for your inputs, because I think we all stand well informed, and I think everyone who will be watching this particular show today should be much more well informed, whether or not they are a cancer patient. I think or everything that you said needs to be really integrated as a lifestyle for all of us. So thank you so much for shedding the light on all of those aspects.
Thank you, Nalini. Thank you.
Thank you. And we are also joined by Ms. Vandana Gupta, who is the founder of We Care Foundation. Thank you so much, ma'am, for joining us. So we are in middle of our conversation with all our stakeholders. So I will just loop you in a bit, but thank you so much for joining us.
Sorry for the delay, but I was in another meeting. So
no, absolutely not, ma'am. Thank you so much for even sparing your time today with us. So thank you so much. Dr. Khurshid, we were like, I was posing a question to you, and I will circle back again to you that, we have talked a lot, for so far about the psychological and the, mental support and, all the other, aspects that play around, all those factors. There's another, critical aspect in India, which is, maybe, on the other side of the cancer care spectrum, which is palliative care. We usually do not talk about it. It is seen as a very new concept in India, while it is not a very new concept for cancer. But in India, it's been like some 2-3 decades only, I think, or maybe even the NDPS Act and everything is just, is still evolving. Implementation is still sort of a problem. But what is really palliative care, and can it really impact a good palliative care? Can it really impact on the quality of life of a patient? Over to you.
Thank you, Nalini. So very, very true. And I would not say that it's the other end of the spectrum at all, because palliative care is to start from the time of diagnosis. It's a very misunderstood term. Everybody thinks palliative care is end of life. Everybody thinks palliative care is when no other treatment is possible, but that is not the case. The simple definition which WHO has made for palliative care, that it's a service provided to improve the quality of life of the patient and their families with a holistic thing, which is not only physical, but also psychosocial and spiritual. So that's as simple as what the definition of palliative care is. Now, to integrate this into our system, at least we in our center, we have a palliative care center which runs along with the chemotherapy center. So the basic idea is, like I think one of our counselors mentioned, that it is not looked upon very nicely if you tell your patient, please go and see the counselor. So, because again, there are these taboos and there is this whole hesitancy of like, am I mad? What's wrong with me? So we do it as an integrated part of our whole thing. So the first meeting after the oncologist has seen the patients, we have a team meeting where all these people, and again, palliative care is a team effort. There are it's a multifaceted, care which is provided to the patients. So we have a nutritionist, we have the counselor, we have the physiotherapist, we have a palliative care physician who is there and who tells the patient that, look, we are all here to support you throughout your journey. So, so once it starts, and of course, as you mentioned, internationally, ASCO, ESMO, in all their guidelines have specifically for advanced cancers, patients who are diagnosed with advanced cancers, palliative care is to start at the time of diagnosis. Have we seen a difference in it? Most definitely, yes. Today, the oncologists, all of us, we understand the value of palliative care because once the patient is supported throughout the journey, so many times the treatment is pretty harsh, like we know. There's a lot of dropout rates. People cannot afford the treatment many times.
Right.
So, when you're giving them the social support, when you're giving them, putting them in touch with social workers who will get them, who will manage to address their financial needs probably, or you will put them in touch with psychologists and counselors who are just here to, who are just there for that matter, to be with the patient. It makes a whole difference. And the compliance to the main treatment also improves.
Yeah.
So like a lot of times we've seen by research and by, documented, like everything is evidence-based today. We have evidence to show that, early palliative care improves the prognosis of the patients. So there are multiple reasons, of course, like we've talked about the mind-body connection. We've talked about the food connection. So obviously, once we put in all these factors into the treatment and not just the mainstay of the radiation or the chemotherapy or the surgery, definitely the prognosis of the patient improves. And not just the prognosis, but the quality of life of the entire family improves.
Right. Thank you, Dr. Mistry, for sharing that. But then, like you said, that it has such a remarkable impact on the quality of life of a patient. In your experience and with your technical knowledge, where do we stand with respect to palliative care? Because it's still evolving. It has still really not penetrated the way it should. So how do we sort of integrate that, and where are we in terms of palliative care in our country?
Absolutely right, and you're really correct in that it is evolving. Let me put it that way. Today in our city of Mumbai, and not just Mumbai, I would say Maharashtra, we have several palliative care centers. We have NGOs like ours also who provide services. We provide home care services. There are different models of palliative care. Even corporate hospitals, which at one time, they thought it was not worth their while to have a department of palliative care because probably it was not so profitable.
Yeah.
Even corporate hospitals have started having a department of palliative care in their hospitals. So of course our government hospitals like Tata Memorial and those were some of the first ones which we started with. But today it is definitely evolving. We have different models of palliative care which are emerging. So, people even who are in private practice have tied up like with NGOs like ours. And there are several others. I would say, just to name a few, there is Romila Palliative Care, there is PalCare. And these are all foundations. So they provide free of cost services. And we even take care of home services. And this whole thing about, coming back to end of life, which is also a very important part of palliative care, of course. And, we, unfortunately, again, as we've always mentioned, the financial burden with cancer is definitely there. If it emotionally and psychologically washes off the patient, financially too, there is a massive drain on the family.
Yeah.
So even towards end of life, where unnecessary hospitalization or unnecessary treatment can be avoided.
Right.
And good quality of palliative care can be given. And the end can be made peaceful. This was another very startling this thing that we had seen, that as we have quality of life, we have quality of death. And at one point, India rated really, really low. We were the last 13th in the whole survey that was done with multiple countries.
Yeah.
I think in our current survey, which was done about 2 years back, we have definitely improved, but we have a long way to go with our quality of death. So that is something to which we have to keep in mind. And, we don't want to have patients dying with machines, attached to them, far away from their families, where they have nobody to hold, handhold them. And so we are increasingly making it possible for patients to die at home. We are increasingly making it possible by educating the patients and their families, especially their families, because there's also this big guilt factor that have I not done enough for my patient? So once you assure them that, everything that was possibly which could have been done has been done, and then the end of life can be peaceful and at home with their near and dear ones. is a very important factor. So yes, it is evolving. Yes, we are way behind maybe many countries, but we are getting there, I would say. Right. So on an optimistic note, I would say that we have, and I think people are understanding the value of palliative care. Right. As earlier it was just end of life care, it's no longer that. It is a holistic care of everything that we have spoken about. And increasingly, we've already acknowledged the fact that cancer is a lifestyle disorder. Yeah. You know, we've spoken so much about food, but we've not spoken about things which are not in our control, like genetically modified foods which are infested with chemicals and fertilizers. So, those are so many things which are not in our hands. Correct. But in spite of that, we do acknowledge it as a lifestyle disorder. And if we address it holistically, I'm sure the life and the quality of life of the family can improve.
Absolutely, absolutely. Thank you so much, Dr. Khurshid, for pointing that out, because when it comes to holistic, health, I think various other things that we have talked about so far are important, but I think even palliative care is an integral component of that entire continuum that we're talking about today. So, Vandana ma'am, I'll just circle back to you. You represent a very important patient support group that we have, and your organization has been doing a lot of work in the area of supporting patients. So, first of all, to understand that how do you think that patient support groups they play that important role in ensuring, a holistic well-being and a care for patients, for the cancer patients, and what impact do they have, on ensuring the quality of life for the patients and the survivors? And what is it that your organization is also contributing to? Over to you, ma'am. Ma'am, can you please unmute yourself?
I may have to start in the beginning, in the sense when I had cancer. That was about 29 years back. Yeah. And, anything that I wanted to know about cancer was not informed to me. Because A, the doctor didn't have the time. B, there was nothing available for me to understand my disease or the side effects or anything at all. So it was like, just groping in the dark. And I was initially diagnosed in stage 2, and then it went on to stage 3 by the time my treatment started. Not because of my delaying, but because there was some confusion about the reports and all that. So you can imagine the mental trauma that I was going through, whether I had delayed the treatment too long, but there was really nobody to answer those questions. So, during my treatment, not initially, but after some time, when I began to think that I'm getting better, I decided that I should do something for all the cancer patients, as many as I can meet, and tell them as much as I know. So that became like a focus in my mind to work towards, and maybe that was something which helped me recover and get well soon. So anyway, once the chemotherapy finished, I spoke to the doctor, and he said, we'll wait for some months because I know nobody comes back after some time. So that was an additional challenge. So with that, we started the organization. Initially, I was alone. Gradually, more people joined in, and it became like a team. And what we thought was that, we have to educate people from the time they are starting, they're not even cancer patients. So you start with the prevention and the screening part of it. So that people are aware that, some cancers can be cured, detected even before you have cancer, and it can be also taken care of in the early stages, like in the pre-cancerous stages or stage 1, because that is what we were trying to focus on, that we have lifestyle cancers, and if they are detected early, it can be treated. The second part was that, you are a cancer patient, you have this particular disease. What does this disease? So we started making pamphlets which were easy to understand, like anybody in class 4 or 5 could read those and understand them, and had them in multiple languages. So
I think we have lost.
What effects it has on the family and all that. So that counseling meaning, not counseling in the sense of having a trained counselor.
Yeah, we have a bit of. Ma'am, are we audible?
Yeah, you are audible.
Yeah. We lost the last part that you were talking about.
So it was not like having a trained counselor sit there and like judge a patient or talk to the patient or something. It was more like, we were there, we had gone through the experience of cancer, and we understood what, not really understood, but we could give our suggestions, because nobody really can understand a cancer patient. There are so many other things that a patient goes through, which you will not even know unless you have really spoken to the patient. Or, because you may say, oh, I understand. How do you understand that a patient has left his family and come? What are the traumas or the challenges that the family is facing there? So the mental state of that patient, you cannot understand. Similarly, somebody may have lost his job and come for the treatment because he has to be with his wife or he's being treated. So it's easy to say, I understand, but it's not, it's really difficult because you never really understand. So you just have to be with the patient to tell them that if you have a challenge, if you have a problem, then we are here to help you think of different alternatives. And you choose the alternative which suits you best. So I think that became our thing, that we were not advising people, or we were not imposing ourselves on them or something like that. We said, if you're facing this problem, then this can be one thing, this can be the other, this can be. You choose according to your needs, which is the best. Absolutely. So that's how we went about it. And also, the doctors began to appreciate the work because they also realized that they didn't have enough time and they needed more time with the patient.
Yeah.
And they were treating hundreds and hundreds of patients in a day. So here there was a group of people who understood what the doctors wanted to say, because we took training with the doctors, and they made that to the patients in a very simple language. And also, if the patient had a particular problem, then we discussed that with the doctor, and either the doctor could talk to the patient or we could explain it to the patient. So I think all those factors made a difference in our working with the patients. And then, as you know, the patients either got better or got into a advanced stage of the disease. So if they got into the advanced stage of the disease, it wasn't like, now nothing can be done about you. There are lots of alternatives even now, like Khurshid mentioned, that, there's palliative care actually should be spoken right in the beginning. So it doesn't become like, now nothing can be done, so palliative care. So that is what we were saying, these are the various treatments that are there. So as a palliative care patient, you can be treated for the, and kept comfortable. So all those type of things, plus also, helping them in rehabilitation, in getting the children going to school, in helping the patients who are in advanced stage of the disease, if they wanted to set up a business, or there was a girl who wanted to become a beautician, but she didn't have the resources to buy the beauty kit and do the course. So we said, we'll help you with that. And today she's a flourishing beautician. So things like that. Somebody wanted to open a shop, so we'll give you the money for it. You open the shop and you tell us how it's doing. Somebody wanted to. So overall, I would say we were taking care of the mental state of the person. We were trying to take care of the physical conditions, trying to understand the financial liabilities that a patient and the family has and how they could work together. So, I would always like to say that whatever we are and wherever we are always in a situation where we can help another person to understand their own challenges. Once they've understood their challenges, we can help them close the cancer care gap. That is what I
Thank you so much for your really valuable inputs, ma'am, because I think whatever you've talked about, it's a very patient-centric approach that you've taken, and also really not imposing anything on the patient, rather explaining it to them and giving them the options that this is what it is and these are the options that you have. And I think it's really very important, way to, help the patients when they're already going through so much after diagnosis. And also second point of integrating them. If they have, diagnosed and they're getting treated, how do we reintegrate them, back to the normal life and normalized situation? I think those are very, very critical points that you talked about. And I think taking that forward, I would just go to Miss Matrushri Shetty. Miss Shetty, I think you also, represent a similar ecosystem. So if you could just, from your experience, explain and tell us that, what really your organization is also, doing, and what are the contributions that are being made, and what are, maybe, there could be some gaps that we really need to also overcome, when it comes to a patient-centric care, through patient support groups.
So, Dr. Nalini, right now with Lung Care Foundation, our focus has been more on advocacy-related work, and we plan to focus more on. We need to actually strengthen more on this, and moving on to the tier 2 cities especially. Because a lot of cancer care, aspects can be dealt with if we promote for early diagnosis. So that is something that we are really looking at through our advocacy outreach programs, and eventually once the advocacy starts, we also look at building more local support groups, and maybe involving a lot of RWAs in the process of this thing, to set up help set up localized support groups. So that's something that we are still in the process of planning, but I think what Madam Vandana had mentioned, I think is quite relevant in terms of balancing out what the actual needs of the families are versus what is perceived needs. So that is something that is going to be very, very crucial. A balance between technical support and also the support, the livelihood support and the existential support for many of the families. That is also something that needs to be built into the process when we talk about support groups. The support group doesn't have to be, cancer is the focus of bringing focal point where we bring these people together, which brings people together. But there are many socio-cultural, emotional needs around that, even economic needs around that, which also needs to be dealt with. I think a program moving forward, we are looking at encompassing all these aspects. So hopefully we'll have a good model to share with you by the next meeting whenever we have, and we are able to actually, this is a very good platform where we are also learning in the process. And we seek more inputs from the others, and I'm going to reach out to everyone and get their inputs in order to build a very comprehensive holistic systems based on your own experience, your experiences in the field for so long. So that's from our end, and hopefully this program is going to start very soon.
Absolutely. And I think our good luck to you for that, because I think it's a knowledge sharing. I think when we talk about defragmentation and, localization of cancer care and various other, components that are critical, I think it's a lot of resharing and sharing of knowledge that should happen and that can happen, right? And I'm sure, I think that should be one of the way forward. And Ms. Rebecca, I think I'll pose the same question to you, because again, it's a patient support groups that are in question right now. What has your organization experience been in this, dimension of supporting patients?
So we are a little different in the sense that we look at it both in the senses technical as well as the whole gambit of the emotions. See, a lot of our patients come from backgrounds where there is no knowledge of cancer at all. And a lot of our patients also don't know their diagnosis. This is a decision taken by their caregivers. So they are going through this entire treatment in complete absence of knowledge, of information. So that is one big hurdle that we face. So we, what do? We actually train our, the nurses, the daycare doctors in recognizing emotional distress, and also, at least on a barefoot level, learning to handle that. Because like also will realize there are very few counselors working in the field of cancer. So we do a lot of training programs for onco nurses and onco daycare doctors and even medical professionals within the field of cancer in recognizing emotional and psychological issues. The second is that what we do is we do what we call peer cancer support. So we try to match a patient to a survivor. So if I have a 32-year-old woman who's been diagnosed with cancer, or a 19-year-old young boy who's been diagnosed with sarcoma, I try to match it with a survivor, because then that connect comes easier. Also, we also match caregivers, because I think caregivers burnout is very high, even more than, because everything is patient, the caregiver gets pushed to the side. So we also try to match them up. We also are a lot into research. So not only in terms of social research, but also like we have a fund where we encourage our doctors to get into research. So we're not just tailor making what is there available in the West. Complement it to our Indian cultures.
Right.
So, and one thing that is probably unique to our organization is that we have a survivors conference once a year. So we have survivors that come, patients and survivors who come from the western part of Maharashtra, including Goa. And it's a free of cost conference. So we put right from the transport to the stay to the accommodation. So because they don't have access to information, we're giving it to them at least once. Counselors is pretty expensive, and that is one of the reasons, apart from the stigma and the taboos related to mental health. The other reason is that it's a big expense. A minimum charge, I'm sorry, I'm putting it quite public, but a minimum charge of a psychologist or a counselor is 1,500. And as it is, I'm paying so much for my treatment. And if I get well physically, I look after myself psychologically. So we try to give all of this in a way that is available and accessible to our patients.
Right. Absolutely. Thank you so much, Ms. Rebecca, for those last points. And Ms. Hiba, I'll circle back to you, because I think we are talking about some correlations of supporting the patient and also the mental health component to it, and how, of course, we need maybe more access, and access sometimes is dependent on cost and all. So do you think, are there any sort of educative material and knowledge which is also readily available for patients on mental health, that and could be a other cost effective way, and how do patients sort of access it?
Before I answer that part, Nalini, there's something I'd like to add to, I think, what Rebecca was also saying, and something that we've also experienced and heard, right? A lot of times people look at mental health health, as something which is more of, I don't want to pay extra for that, right? So as a service, it's not really valued considering the impact the illness is already having. So they're willing to spend, God knows how much amount of money on multiple visits, multiple tests, everything. But even say something, whether it's 500, 1,000, 1,500, whatever. I mean, I'm not getting into the costing of it. It's difficult for people to prioritize mental health. And so that always ends up taking the back seat, which in itself is a different discussion. Because as professionals, when someone is offering the help, it is the exact same thing as going to a general physician. So then why not? Why my mind doesn't deserve the same care might say my body does, or any other organ. So that's a different thing. I just thought, we were having a conversation.
No, absolutely.
So I thought I'll mention. In terms of the sources, the most reliable and widely available at a free level is the other NCCN patient guidelines, especially because they've made distress as the 6th vital sign. So they also talk about patient guidelines on their portal, and it's accessible. It's in a PDF form. You can just type it on any search bar and they can take it. Apart from that, different organizations, different hospitals, especially I know for a fact that tertiary care hospitals and large government setups also have pamphlets and leaflets in multiple languages, not just English. So you have regional languages. You have, common language, Hindi being the national language, which is available largely, and people can access through their own hospitals where they're getting treatment. I know for a fact Max has a lot of them for different disease management groups, support groups included. But of course, there are, all these wonderful organizations that are doing that kind of work. So it's just a matter of how much awareness and availability, but the main is NCCN patient guidelines under the section on distress for patients and how to manage it.
Thank you so much for, detailing out. And I'm sure, I think this should be helpful for many patients, who due to various reasons cannot access, other kind of, counseling and psychological support. My next question is for Dr. Khurshid and for Miss Vandana, for both of you, that, here we are talking about, the psychological aspects, the mental health support, and all other kind of support, that we can provide to the patient. But what would be your recommendation, because you both have decades of experience, working in and around and in a very patient-centric manner. How should patients really kind of prepare themselves on day-to-day basis as daily routine, so that they can continue and first of all complete their treatment, and even once the treatment is over, how do they integrate? So there has to be sort of one approach, that patients, we can also recommend to them that what they should also be doing. So Dr. Khurshid, we'll start with you.
So actually there is no one approach to it, because like we've already realized, and especially Mumbai being the hub, we get patients from across India. So there is definitely not one approach that we can advise or advocate to all patients. What we do try to tell them is to try and be as physically active, as active with their daily routines, their daily work processes as is possible, of course. And like, as I said, again, we've been talking of mental health and things like that. So making ourselves available, telling them that even if they are not physically here, we could be a phone call away. We have helplines. We do give our numbers to them.
Yeah.
And we say that, whenever necessary, they can approach us. Our center is a walk-in center, so patients can at any given point of time, even if they don't have a appointment scheduled, they can definitely walk in and, be with us. And even post their treatment, we do encourage them to kind of, first initially it's monthly, and then it's 3 monthly, and then 6 monthly, but we do continue to have visits planned for them.
Yeah.
Secondly, support groups, like somebody mentioned that there are not enough support groups for other diseases apart from breast cancer. There I would like to, they may not be enough, but at least we do have our disease specific support groups. So prostate cancer patients, they have their own set of troubles, they have their own set of problems. So hence we cannot generalize, but we do form these support groups to which these patients can reach out even after their treatment is over.
Yeah.
And the patient advocacy itself, a patient survivor can be one of their best friends. So these support groups actually helps the patient to connect with people with similar kind of problems.
Yeah.
And they do, and this is not a one-time process. This is an ongoing process. So
Correct.
Even after their treatment is over, and once they have integrated back into their daily routines and things like that, their periodic checkups have to be there. And this is where the support groups definitely help. And we do reach out also. So if they've missed their turn of this thing, what we from our end, we kind of call them sometimes and say, look, we think you missed your scheduled appointment. So, what is the reason? And especially during the COVID era, it was really difficult for patients to come, especially the out of station ones. It was difficult for them to this thing. And then technology has helped. Teleconsultations have become possible.
Right.
So basically that's how we try to integrate. And the most important thing is we definitely encourage them to go back to their routines as much as possible.
Thank you so much. And you just mentioned, the impact of COVID towards the end. So that was one, watershed moment that sort of disrupted, a lot of services and cancer programs and interventions at various levels. Are we still in that, in that similar space, or are we overcoming all of that? And, where are we on that particular, era?
I think we have overcome it to a great extent, except when we are in the middle of a peak wave, like we had our third wave. So January, was a little bad, but again, we are again going back to routine. Train services and all have not. So I think we are crawling back to normalcy. Let me put it that way. There are no treatments which are being put on hold because of COVID today. People are being able to come for their routines. But again, as I'm saying, if it's only a routine checkup, we discourage them from traveling, and we are trying to do it through teleconsultations. We tell them to do their tests in their local place, and then they send us the reports. So we are crawling back to normalcy, I would say. In the middle of the peaks, we have to keep things on hold. So like, for example, in January, when it was again getting a little bad, situation was getting a little bad, we had to keep on hold a few chemotherapies and few, this thing which we thought could wait. I mean, obviously the ones which cannot wait, they yet get prioritized. But just to maintain the distance and things like that, we have to, like, prioritize some up to as opposed to the routine ones.
Right, absolutely. Vandana ma'am,
Nalini, can I just interject?
Yes, absolutely.
I'm
Please
so sorry, because we were talking about COVID, and this is something that I failed to mention. When we went into the first lockdown, some patients whose chemos we could not avoid, but they wouldn't come to the hospitals because of the fear of COVID. So we started a program called Home Chemo, where we would send a trained doctor and a trained onco nurse. They would go home, they would stay the whole day, see that so we offered that services. Fortunately, because things have come back to near normal, at least in Pune, everybody is going about thinking there's no COVID. We've got back to normal, but we still give it as an option. If there is somebody who's really afraid of it, it's there. So.
Absolutely. And I think that's what, while it was a time of disruption, but newer models of care have also emerged. And I think those are the things that, I think we should also build upon further. Vandana ma'am, the same question to you, that, when it comes to patients, how we should prepare patients, and, what can be, certain ways that patients can be, prepared for that, so that they resume, the daily routine better, and, what would be the advice for patients and their caregivers?
So at WeCare, what we tell the patients is, since we are, interacting with them almost regularly, because they're coming to the hospital and our volunteers are in the hospital, and we talk to them, and we hope we build enough confidence between them for them to talk to us and tell us about their things. So we always tell them that, once you go back, then life has to become normal as possible, because, like, for example, if I see a child hitting his mother and the mother keeping quiet because the child is undergoing treatment, I tell the mother that, do you realize that you are inculcating this habit in the child that he can hit back? So and are you believing that he's not going to live forever? If you believe that, then it's different. But if you believe that he's going to get well, then this is not the habit that you should encourage in the child. And I tell the child also the same thing. Why are you taking advantage, and why are you hitting your mother? So, I mean, just as an example. So we try to tell them throughout that, they should be as normal as possible, because we are believing that life is going to be normal again. And once the life is getting to be normal, then the habits that you pick up at this time will not be appreciated by anybody. And you don't want to be a social misfit as you grow. It can be for a man, it can be for a woman, it can be for anybody, for a child. So during our conversation, we do try to tell them about these things, that they have to be normal. And besides, meeting them in the hospital, we also have a system where anybody who has interacted with us, who has had financial support from us, or any type of support or interaction, we have their phone numbers and details and all that, and we make it a point to call them up.
Right.
It's a regular call that we make once, at least 2, 3 or 3 such calls are made, so that they know that we still care for them. It's not like because we met them by chance in the hospital that we spoke to them or something like that. Right. So these 3 calls, in a gap of say 1 month or 2 months, really make them feel that, we are concerned about them, and that we want to be with them and handhold with them, and, keep answering to any issue that they may like to have. And I think that makes a lot of difference. Of course, during the COVID times, it was really useful because, they were not able to come so often. So while talking on phone, they felt very good. And then often we would have like a Zoom call with many patients of the same disease being together. And they would talk about it and, talk about whatever they could do and share, and that went on very well. But having said all that, I really feel that most of us work in isolation. All the groups are working in isolation.
Yeah.
And we don't like to either share things with each other, or we don't even try to find out what somebody else is doing. And if we are really keeping the patient as a focus, each one of us, even here, whoever is here, we should know what the other person is doing, because then only you can guide a patient to go to that particular group or particular area and, be guided. And you can also learn, because I can't claim that I have all the knowledge, but if I know that there is somebody who's doing this, I can learn from that person and help the patient. So I think also the onus is on the organizations that are working with cancer patients, that instead of working in isolation, instead of being by themselves, they need to collaborate. A collaboration is an extremely, extremely important word, and we should all work together. There's nothing like, you lose your funding because you're collaborating with somebody, or you lose the patients, because how does it matter? You're not here to lose or gain patients. You are here to help the patients. So I think that is an onus that we all need to take up. And, suppose I know that there's somebody who's very good in rehabilitating for a patient for their jobs. I should not feel shy to talk to them and tell them that, this is a patient who needs this type of help. Do you think you can help them out? Or guide the patient to say, go to that person, they will help you out. So I think that's important from our point of view. And when we're talking about COVID, I always feel that the big C was always cancer. And so the glory to cancer has to come back, because COVID may stop whatever time it may take to stop, but cancer will not stop. Cancer will continue. And so we need to be mindful of that. And we need to be mindful of, what we can do, how we can improve the quality of services for the cancer patients, whether it is caregiving, and caregivers are important, especially during COVID times when caregivers have not been able to accompany the patients, or they have to be away because of the fear that if they go to a hospital, they may catch COVID or something like that. We need to be understanding of that. And so what we really need to do is work towards getting a better normal for cancer patients, and not work towards a new normal. New normal is okay, but a better normal is the key word which I feel we should work, and we can do it together, all of us together. One more point that I wanted to tell, that, what I have noticed, that people are hesitant to go to mental issues to professionals. Not because, they don't understand that there's a mental issue, because they always associate, because you have cancer, you are going to have these type of things. That is one thing. And the second thing is that they feel that, I've already had cancer. Now do I have a mental challenge also? So it doesn't become that there's a double whammy of these two things together. So they want to avoid going to a counselor, because they say, "Hame koi taklif nahi. We don't have any problem." But so for that, what we normally do is that we sit down and talk. And the more you talk, the more the issues come out. Sometimes the issues are something which we can take care of. Sometimes there are issues which we can help them take care of. And sometimes maybe in a very gentle manner, we can guide them that there are people who are professionals who can tell you or help you. And, like you go to somebody to ask for diet. It's the same way that you go to somebody to ask for mental diet. And it works out that way. I mean, here I must share a story of a person, his child had come back for his checkup, and it was almost like the last checkup, because 2 years of his maintenance therapy, everything was over. And the child was doing extremely well. But when they checked the child, they found that the child had 98% blast cells, which means he didn't have time to live at all. And when the doctor, he called me and he said, "Can you talk to him and explain to him?" So it was very tough, because, nobody wants them to feel that, they are not going to treat the child because the child may not live for more than some time. And he said, "I'll sell my property, I'll do this and I'll do that." And I said, "Okay, let's sit down and understand what your liabilities are, what you can sell, what you will get, and everything." So it was like a SWOT analysis that we did with the patient, sitting with him, not telling him that, we want you to do this thing. And after that thing was over, it took us more than 3 to 4 hours to work with him. And he said, "I don't think it's worth doing anything now, and I'm not going to sell any property. And I know I have other children to take care of, their education and all that. But can I go to an Ayurvedic doctor, because we've heard somebody who's very good?" I said, "Please go." do what you want to do, feel comfortable in what you want to do. But as long as I thought to myself, as long as you've agreed not to sell the property, that is fine. And I said, wherever you're going, make sure you're back soon to be, spend time with your child rather than be away from him. And unfortunately, it so happened that within 5 or 6 days, the child died. The father was on the way back from the Ayurvedic doctor and the medicines had not reached. So, these are the type of, it always takes time to listen. I always feel that most of us have this habit of talking. We presume something, we've judged something, and we go on talking without trying to keep a moment's silence to understand what they want to say. That is extremely important, that we have to understand what is it that is bothering them. What is it that they would like to share with us? There was a lady who came to me whose daughter had breast cancer. The daughter was not sharing that with the mother. And the mother was anxious because, she said, why doesn't she talk to me about it? And so we, instead of giving her a lecture, we sat down and we tried to understand what was happening and all that. And again, it was a long session, about an hour and a half. But then she said, now I think I know, because maybe I asked too many questions, because maybe I make her feel very nervous about the whole thing. She must be having to deal with the trauma herself, and I add on to the thing. So it takes time, but it can be done, and we can help out patients. And if we, again, I'm focusing on the fact that, we need to work in a collaboration. We all need to know the strength of each other to be able to help even a single patient. That's important.
Absolutely. And I couldn't agree with you more with you, ma'am, because I think all of us come with our own, very limited set of expertise. It may be, very important, but it is always limited. And I think it's always, again, a cross collaboration sort of, and help, or an effort that really makes the real difference. Miss Neha, I think I will like to bring you in. Do we have Miss Neha with us? Yeah. So everything, that we have been talking about, in a certain way, you've really lived through that entire nuances of these conversations that we are having right now. Post recovery, what has been, your experience, and are you also in a way sort of advocating for the cause now, or are you, because we have been talking about peer support and all of that, do you think emotionally, mentally, first of all, are you there to give or lend that kind of support to others? Because there is always, a spillover, thing which is left, with an individual. So are you there? And do you think, are you contributing to it, or do you think, you would be able to, or, how does it work for a patient? Because we can talk about that, one patient should talk to other and all, but whether the patient is really in that zone to do and contribute, it's a huge responsibility on the patient itself.
Yeah. So first of all, I like to tell every one of you is that cancer is not a death sentence. I mean, you can still live with cancer and achieve all your dreams with cancer. So while going through the treatment, there was a phase when, I isolated myself and I was pondering over my feelings and everything, which was going around me. But then I realized that the more I opened my heart to with other patients, with other people, I was slowly and gradually more coming to terms with that I have cancer. And while I used to go and take my chemotherapy sessions, I used to talk to other patients and help them overcome this chemotherapy fear by telling them about my journey. And definitely I realized that by encouraging other patients, first of all, I was able to overcome my fear of cancer. Secondly, I was able to help them in some way and probably give them a share of light that yes, you can too overcome this thing. And thirdly, of course, when you share experiences with other patients, you definitely learn a lot as to where the gaps are, what you can do better to what you can do better in your treatment, what good inculcate in your lifestyle. So I've also been put through multiple support groups, and we do have this WhatsApp groups, and we do carry on online, we do conduct online meetings, and there are a lot of interactions, and we do get in touch with each other as and when we require. Let's say suppose I have put my query, this is happening to me post my cancer treatment. Of course the repercussions does not go away that easily. So we put our queries in that group, and I feel as if I get multiple calls from random people in that group telling me you can do this and you can do that to get better. So it feels like I have a small family. And yes, of course, as in when I was going through my cancer treatment, I realized I was getting stronger day by day by helping other patients, by talking to them, by actually, realizing that it's not that I need to isolate myself. It's just that I need to pour my heart out. I think with me, that was the case.
Right. Absolutely. And I think it was really good to actually hear this side of the story, because I think it's like you said, it's not a death sentence, and definitely it is not. And I think it's not to just submerge yourself in the kind of aftermath of emotions and everything that comes with it. It's more about evolving out of it. So thank you so much for sharing that. And I think with this we come.
I would just like to come in between. When I was going through my cancer, I was told by multiple people surrounding me that, you can quit your job, you can do this, you can't do this after cancer. And I just realized after 1 or 2, 3 chemotherapy sessions that I do not, if I quit what I think of myself in the future, I was just giving up on my dreams and my life. So I did carry my dreams along with me during my cancer. I mean, I was working throughout. I got a promotion. I got through an IM school. So I was like, I feel that you can still achieve all your dreams with cancer, because you don't need to give up on the bright future. Probably the future can be different for every one of you, but it's there. Right. And you need to believe in it.
Thank you so much, actually, for those wonderful.
Can I add something here?
Yes, ma'am. Please go ahead.
I can understand, and Mona, I would say that Neha has been extremely lucky that she got everything done properly and everything happened. But in India, we have like a very wide and very prominent urban and rural divide. So people who fall into the urban divide probably have better facilities, better everything. And those who fall into the rural divide are lacking. I can say it from my own example that, when I was going through my chemotherapy, I used to have a car waiting for me with a driver who would come and see how much of my chemotherapy medicine was left, so that, he's there on time to pick me up and take me home, so that when I have nausea and vomiting, I'm home by that time.
Yeah.
Subsequently, when I started WeCare and, I was trying to tell people about nausea and things like that, I realized that they have to travel by train and buses and all that. And so to try to tell them that, I could cope with it and you can do too, was not going to work out, because they have a different set of challenges that they are facing. Right. So while we are talking to the patients, we need to understand that difference, that, the luxury that we as people who are fortunate have and those who do not have. The lesson came to me from a lady who came to me asking me for 5 rupees. And I said, what would you do with 5 rupees? And she said, I came with money for medicine, but the medicine price shot up and I just need 5 rupees now to take a bus to go home. And that is the day she taught me the value of 5 rupees.
Yeah.
So, we all have our own issues and all our thinking. And I think we have to understand, while we are talking to any patient, what is it that they would be happy about?
No, absolutely. And I think, ma'am, you've correctly pointed out, that the spectrum of, the patient pool also that we have is a very varied one in India. And I think that's why we cannot have one solution, which can be, prototyped to all kind of patients, and for that matter, not even for treatment and SOPs that we talk about. And I think that's where the role of, all of us who are on the panel today, patient support groups and everyone, who's here comes into play, that, that's a uniqueness that we come, in terms of our experience. And that's how we can sort of build more customized and localized solutions for patients and not wait for any standardized, procedures that needs to be followed. And with this, we come towards the close of our session today. But I would like to open the conversation and just have one, last remarks from all of you. Ma'am, Vandana, ma'am, we'll just start with you here. Closing remarks from your side.
Okay. So, like I was saying, that when we are talking about things, and I've seen this happen in other countries, we are part of various international organizations where they talk about, the caregiver is not able to go with them to the COVID center. And so they find it difficult to understand, and then they take permission to record the conversation with the doctor, and they come back with that.
Yeah.
And I was thinking of our own patients when they go with the caregiver or without a caregiver. Is the doctor giving them permission to record the conversation? Yeah. They ask questions. I know as a patient, I was petrified of talking. I mean, though I'm a very vocal person, though I was somebody who could challenge a doctor, but it was like, I can't ask too many questions because the doctor may get offended.
Yeah.
So, while what we need to do and what we are trying to do from in WeCare also is to empower the patient, to tell them that, you need to be educated, you need to be bold, and it's your life that the doctor is treating. He is not treating anybody else. So if you have asked questions, make a list of your questions, go with those things and ask them. And, if you keep saying the same thing again and again, I think the patient does feel empowered to ask. I wish we could do it for all the patients who are going through treatment, but unfortunately, it's a very small segment that we've started working on, and we hope to reach out to more and more.
Absolutely. Thank you so much for your inputs, ma'am. And I would move to Miss Hiba Siddiqui for her last concluding remarks.
Yes, I think what I just want to add is that because it's World Cancer Day today, and it's not just a day, it doesn't end here. It's just really important to become allies to the people who have experienced, who are experiencing in whatever capacity. You can be a patient, you can be a caregiver, you can be a friend, you can be a healthcare professional, you can be anyone, and be able to support this space and just listen. And like I think everyone added on that, let's just also normalize and prioritize the mental health aspect of cancer care or any other chronic illness. And I think we won't be too far from quoting the West. We'll probably be quoting ourselves after that point.
Yeah. Thank you so much. Moving to Ms. Matrushri Shetty.
Thank you, Dr. Nalini. It was actually a very, very informative session hearing all of you on this platform, and I think it's been a great learning experience. For cancer care, I know that we still have a very, very long way to go. Have to prioritize on so many aspects and bring various other less known cancers into the purview of our national schemes, health schemes. Besides, looking at the treatment bit, the post-treatment, the mental health issues, the care, and other aspects. But I know that with the kind of discussions that we've been having, with the right intent and the right heart and the right people, like the people who are working so hard on this platform, we are on the right track, and I'm sure that we'll be able to achieve really well. We'll be able to cover a good distance in cancer care. And I also wanted to applaud Neha, Ms. Neha Anand, and for sharing her experience, and Vandana ma'am for sharing her experience. I think that really helps people to connect with, the individual personal experiences of people. I know they may be very coming from a certain segment of population which may not be representative, but still these are stories of strength which definitely people identify with, definitely people look up to it, and our effort has to be reaching to more and more people out there, irrespective of their socioeconomic status and their privileged background. So I think that should be one of our efforts, and I'm sure with our ongoing project proposals now that we are building around, I would hope to cover all these aspects that we have discussed today.
Absolutely. And I think you've correctly pointed out that, there are not just economic barriers, but there are so many socio-cultural and different barriers. And I think all of that needs to be encompassed when we think of solutions. We have Dr. Mistry with us. Ma'am, last concluding remarks from you.
So, firstly, I would like to thank this organization for giving us all this platform to discuss this very important topic. Secondly, as we've already concluded, cancer is a lifestyle disorder. So lead healthy lifestyles. Exercise, I think that's one thing which we've not spoken much about, but I think physical exercise is very, very important part of every person's routine. Early diagnosis of cancer, a must. I mean, you treat early, you detect early, you treat early, and that prognosis would be so much better. Cancer care should be patient-centric. It should not tailor-made. It should be tailor-made to every individual's needs. And it is not only cure which is important, but it is the care which is important. So we should not think of cancer as, like everybody said, a death sentence where we are only focusing on cures, but it is the care that we give our patients which is important. So yeah. And it is going to be possible with everybody I heard today, and so many people, like it's not only a job of a doctor, but it has to be a multifaceted care program. So yeah.
Absolutely. Couldn't agree more on that. So Miss Neha, last concluding remarks from you.
I would just like to tell everyone out there that we prioritize a lot of things in our life, like our office, our family, our children, except our health. But one thing I've realized is that our health is the topmost, it should be topmost of our priority. We should actually make sure that, it's just not the physical health, it's also the mental health, the emotional health, the psychological health. We should focus on we should focus on our health, and make it a priority. Like we take care of any other thing. We should make sure that the health should be our topmost priority.
Absolutely, and I think that's one of the key go-home message, I think, for with today. And last but not the least, Ms. Rebecca, last concluding remarks from you.
So I think all of us have put it up really well. There are two things that I would like to say is that as a patient, know your rights. We all have rights as patients, and sometimes we don't pay attention to that.
Yeah.
Become a part of the team. Don't consider yourself on the other side of the table. You're a part of the whole treatment team. And as general public, become more aware, because sometimes we cause more problems and more distress to patients than the patient's the disease itself. So watch your vocabulary, watch what you say.
Yeah.
And as Hiba has said, learn to listen. Thank you.
Absolutely. Thank you so much. And I think these are, I think all your concluding remarks have really summed up our today's conversation. And like Dr. Hiba said that, this is just not one day that we are observing. This is more like, means to an end. And I think the journey keeps on continuing, because the disease that we are talking, in fact, here is an evolving one, and day in, day out, it's affecting millions of people, not just in our country, but globally. So I think, first of all, thank you so much to all of you for sparing your valuable time, for being here with us today, and contributing your knowledge to this conversation. And I just hope, all of you, not just individually, but also maybe collectively, keep, forging ahead in this journey and in the fight against cancer. Thank you so much for joining us, and we also hope to contribute and work together with all of you in the coming days and in the months, and contribute more significantly in the space of cancer. Thank you so much.
Thank you.